Ask Dr. Khan Show. This is episode 173. I can't believe it. We're really moving along. Now, I'm a functional medicine practitioner. In the past several videos, I've been explaining about how the brain, immune, and the gut connection together causes this chronic inflammation, susceptibility to infections, and leads to autoimmune flare-ups. And so we're going to tie this together. This is kind of like the one big episode that's going to tie up all the previous videos together. So if you want to get a primer on the previous ones, I highly recommend you go to our YouTube channel at PeterKhanDC, youtube.com/PeterKhanDC, or our Facebook page at Hope Integrative Wellness. Subscribe so you get notifications of new content that comes out. But the past 4 or 5 episodes, in fact, since episode 168, has been epic. So you want to watch at least the past 5 episodes, including today. Today we're going to tie it all together. So we've been talking about autoimmune. So if you suffer with autoimmune disease, either it's hashimotos, celiac disease, chronic fatigue, fibromyalgia, no matter what you have, this is what's common among people with autoimmune disease. So if you can address the common denominator, the underlying root cause, you're going to be able to get better. So I'm giving you literally the algorithm here, okay? Some of the root causes and the patterns that you want to look for. And I'm going to tell you, I have worked with over 5,000 clients in our online functional medicine program where I work with you one-on-one through video consultation. I've done pre and post lab testing. I made my share of failures. And this is what's gleaned from that. So this can literally shortcut your process so you don't have to struggle anymore with fatigue and brain fog and depression and chronic inflammation and chronic food sensitivities where you're so restricted you can't eat anything. That's stressful. Let's find answers for you. This is going to help you understand it. And if you need help, as always, I'm here to help you. Schedule a discovery call. Schedule a case review with me so I can sit down and plug you into this algorithm and figure out what the root cause is and what you need to do to get better. Okay, so let's start here. You get gut inflammation. The gut lining is 1 cell layer thick. And when the gut lining becomes inflamed due to various issues, such as food sensitivities, infections, autoimmune disease, toxicity, stress, blood sugar, these are all triggers for gut inflammation. What happens is you start to skew your immune system. Your immune system has 2 branches. We have the T helper 2 system and the T helper 1 system. These are helper cells, T cells, immune cells that help do certain things. The T helper 1 cells are the killer cells. T helper 2 cells make antibodies. When you have gut inflammation, you start to skew your immune system toward more of a TH weighted situation where the T helper 2 cells become more active and more predominant. You got more of them and less of them. This is a teeter-totter, by the way. So you start to tip the balance this way where there's more of these guys, less of these guys. Now the problem is the T helper 1 cells are the killer cells. They're the one that kill bacteria. So if you, due to gut inflammation, skewing your immune system this way, you're going to start to create a situation where you're going to get chronic infections. So these infections might include things like bacteria. So you get bacteria like SIBO, or you get infections in hollow spaces, and we're going to talk about that. And you get virus, candida, and parasites. And I would say mold in this category as well. So what happens is these infections, you can't clear it because your killer cells are just not active. Because gut inflammation can skew your immune system and create that imbalance, make it so you can't clear infection. Okay? Now, when you can't clear infection, then what happens is you get systemic inflammation. This gut inflammation can trigger systemic inflammation, which then lead into STAT3 activation. STAT3 activation basically triggers autoimmune. And then this activation of autoimmune can actually go back and cause more systemic inflammation and cause more STAT3 activation, so it becomes a vicious cycle right here. Then STAT3, this particular type of protein that trigger inflammation, it's going to signal to the T helper 17 cells. We have T helper 1, T helper 2. We also have T helper 17. Guess what T helper 17 does? It destroys tissues, especially in autoimmune disease. Autoimmune. So when you get rheumatoid arthritis, your joint gets deformity and destroyed, it's because of T helper 17 activation. These immune cells trigger the actual damage to your own tissue. Like people with ankylosing spondylitis or lupus, the actual skin problem that shows up as psoriasis and eczema, the damage is actually done by Th17. The thyroid cell, hashimotos, your thyroid cells get destroyed through the activation of T helper 17. So this right here triggers that which destroys your own tissue. So you get inflamed, you get pain, you get tissue destruction that leads to decreased function. If it's decreased tissue destruction to your thyroid gland, you don't make as much thyroid hormone, you start to gain weight, lose hair, cold hands, cold feet. See, the symptom of low thyroid is a symptom. What's causing that? The thyroid cells are being destroyed or they cannot make it. Could be either scenario. If the thyroid cells are being destroyed due to an autoimmune process such as Hashimoto's or Graves', this is what's triggering that. And when you destroy tissue, what happens is you're going to trigger other things, okay? So let's review here. You're going to have gut inflammation, skewing your immune system, causing chronic infection because you can't clear it. At the same time, gut inflammation is going to create systemic inflammation, and that's going to create this autoimmune STAT3 activation, these particular type of immune protein, was going to trigger Th17 to destroy tissue. And that's going to trigger autoimmune flare. When you destroy tissue, what you're doing is you're throwing off fragments. You're throwing off more cellular debris. And the more cellular debris you have, the more your body has to clean up the cellular debris. So basically that in itself can trigger more systemic inflammation. But because you have these cellular debris, your body may actually develop autoimmune and autoimmune flare-ups, or you develop new autoimmune disease. This is how people develop multiple autoimmune disease. As you destroy tissue, you have these antibodies and tissue protein that's floating around. Perhaps from your joint, from your thyroid gland, that's floating around. So now your immune system is going to pick up these proteins and say, this is not good, I got to clean it up. So start targeting that protein, targeting that particular antibody. So now you get autoimmune flare-up. Or you develop additional autoimmune disease. You don't just have Hashimoto's now, you also have lupus. This is how people develop multiple autoimmune disease, one of the ways. So you get autoimmune flare-up, which is why people come to us, right? People come to me because they've been to everywhere else, nothing's helping, you're already taking a bag full of supplements, you got a kitchen counter full of supplements, you're still not better. Or you already seen the naturopath, the nutritionist, the acupuncturist, whoever it is you're seeing, you've been to the Mayo Clinic and nothing is helping, then we gotta start to break this down. And this is how we break it down, okay? The flare-up, the symptom is what drives, right, you to look for answer, but you have to understand where it's coming from. So I'm literally showing you the map where these things are coming from. Now, this is what we covered in the last several weeks. So how does that lead to brain? So know that systemic inflammation triggers brain inflammation. So this is a picture of your brain. So your brain becomes inflamed. Okay, through the immune system, through cytokines. Cytokines are immune messengers that are text messages that your immune system sends to the rest of your body to say, hey, there's an injury here, there's a toxin here, there's a bacteria here. When you have systemic inflammation, the whole body is on high alert. So all your immune cells are sending text messages to each other saying, we're inflamed, danger signal. And this is going to cross through the blood-brain barrier and trigger brain inflammation. And guess what brain inflammation feels like? It feels like fatigue, brain fog, short-term memory loss, you can't get the words out, you feel depressed, you feel lethargic, you have low motivation, you have anxiety perhaps. See, that's brain inflammation, folks. But everybody wants to treat the symptom of that brain inflammation. Oh, you're depressed, here's Prozac. What's Prozac going to do to dampen brain inflammation? Not much, not at all. So you have to address the root cause. When you have brain inflammation, what that does is it decreases your brain function because your brain cells, when they're inflamed, they cannot transmit action potentials. Okay, so your neuron to neuron nerve transmission slows down, and that decreases your frontal, your cortical output, your brain function decreases. And as your brain function decreases, that brain function contributes to vagal function. So you can have a decreased vagal output. Let's just make it more plain. Vagus nerve. Gosh, I'm in trouble here. Nerve function. Now, the vagus nerve is a nerve that comes out of the brainstem, right about there, and innervates all the way down to your gut and stimulates gastric secretions, bile flow, liver function, all the digestive function is very much controlled by the vagus nerve, which calm off the brain. So when you have brain inflammation, you can have decreased vagus nerve function. Well, turns out that vagus nerve function dampens inflammation in the gut. So the result of brain inflammation is going to be decreased vagus nerve function, which will cause increase in gut inflammation. Furthermore, decreased vagus nerve output is going to cause decreased gut motility. GI motility. Meaning your intestines have to push food through downward, right? Eventually you poop it out. So if you have decreased gut motility, that means things are not moving through, because for you to push food through, it's a muscular action. Anytime we have muscular action, some type of nerve innervation has to happen, and vagus nerve is what does that. So decreased vagus nerve output is going to decrease gut motility, so now you get constipated. Now thing just sits there. You don't have regular bowel movement. It comes out hard and dry. And then sometimes you get a spasm because your gut just reacting to that. Then you get loose stool or diarrhea. You get alternating constipation diarrhea. Can be due to just simply decreased vagus nerve function due to brain inflammation. So then you have this decreased gut motility, and guess what happens? Things have to move downward. And if it doesn't, in your colon, that's where all the bacteria lives. If things don't go down, they may regurgitate back up. So the bacteria start going into the small intestine where it's supposed to be sterile. So now you get gut infections. Now, because of decreased gut motility, you get SIBO, small intestine bacterial overgrowth. Where normally bacteria don't get in the small intestine, now it does. So now, I don't care how much you treat the SIBO with antimicrobials and antibiotics. You keep treating the SIBO, you still have it, it's not going away. You need to start thinking about maybe it's not just SIBO. Maybe it's not just the bacteria. Maybe you have decreased gut motility. And what's the reason for that? Maybe due to decreased vagus nerve output. And why do I have that? Maybe due to inflammation in the brain. And why do I have inflammation in the brain? Perhaps due to systemic inflammation. Systemic inflammation. Why do I have systemic inflammation? Perhaps due to gut inflammation in the first place, causing the skewing of this shifting of the immune system, so now you can't fight things off. So it's not that your body, that you're catching everything, it's that you can't fight it off. You have an immune system weakness. And this is what happens when people have autoimmune disease. You have this immune system weakness by the virtue of having systemic inflammation and STAT3 reactivation. You start to get this skewing of your immune system, so you can't kill off things. And you start to activate, by the way, these chronic infections activate the T helper 17, which destroys your own tissue. These chronic infections activate TH17 because TH17 really is there to help you fight infections, but it also destroys your own tissue because it turns a gun on you. And it really fights infection in these hollow spaces. Hollow spaces will be like your sinus, your lung cavities, your gut is a hollow space, and then your bladder is hollow space. So chronic UTIs that you can't clear, chronic lung infections, like you just keep getting cold upper respiratory infection, you can't clear it. You keep getting sinus infection that you can't clear, chronic gut infections that you can't clear. These are all problem with infection in the hollow space because you can't clear it, and you have this TH17, which is supposed to clear the infection in the hollow space, because you can't clear, just constantly activate it. So this is just going crazy, and now start to develop autoimmune disease, and then you start to destroy tissue. That's why you hurt. That's why you're inflamed. That's why you don't get better, because central to this issue is not the infection. It's that your immune system is shifted out of balance. And really, isn't that what autoimmune disease is? It's that your immune system is out of balance. It's attacking your own tissue instead of foreign invaders. That is a central problem. But when you have hashimotos, what do? You take a hormone. What is the hormone doing to balance the immune system? Nothing. When you have celiac, they tell you to go gluten-free. What's going gluten-free doing to clear the infection and help balance the immune system? It's one thing that you need to do. Sure, you need to not eat gluten so you don't continue to trigger an autoimmune flare-up. But what about all these other immune factors? Gluten-free by itself cannot do it. You got to do other things. Okay? Now, there's other connections here. Let me help you make more connections. So the lines will help. The chronic infections trigger autoimmune flare-up by itself too. The chronic infections also drives more gut inflammation. And the chronic infection also drives systemic inflammation. You see how everything's connected? It's more than just a linear arrow going from here to here to here. Everything's connected. Okay? And then these, not only the chronic infection drives this T helper cell, guess what? Just by virtue of having this out of balance immune system here, where the T helper 2 system is too strong and the killer cell is not strong enough, both of these contribute to the Th17 going more crazy, attacking your own body, creating more infections. So that by virtue of having this immune system imbalance, it creates other immune system imbalances. And by the way, when you have systemic inflammation, this spits out insulin. When you're inflamed, you become insulin resistant. That means insulin doesn't work anymore. And when you're insulin resistant, you can't lose weight. You have energy problems. You might develop hormone problems like PCOS, polycystic ovarian syndrome, which is the #1 cause of infertility in the United States. And as you develop insulin resistance, it turns out that insulin resistance actually blocks vagal nerve activation. So when you have too much insulin, it blocks this vagus nerve from stimulating the gut to actually have a movement. So then that persists and causes more of this problem, which leads to SIBO. And guess what? When you have SIBO, what does that do? SIBO is happening in the gut. It's a hollow space. When you have an infection in the hollow space, you can trigger T helper 17. So you get more autoimmune destruction and more autoimmune flare-up, because that's where the arrow goes. And this SIBO not only causes autoimmune flare-up, it also triggers more gut inflammation. And remember, gut inflammation, this block is the same block that you see here. So then this is triggering more of this to happen, so we'll go this way again, create more imbalance. This is what happens. Now, is there hope? Yes, there is hope. You first have to understand this. That's why I'm showing it to you. Next, you work with a doctor that can help you with that. You either do that by watching my videos, consuming my content, watch more. The more you learn. Remember, every whiteboard is just another piece of the puzzle to your health puzzle. Okay? So watch more of my video, and if you need help, give us a call. You can schedule a discovery call. We can talk to my assistant to find out whether our program will be appropriate for you. We don't take everyone. Certain people just, I don't want to change my diet. I don't want to do anything. Well, it's teamwork, right? So we talk to you to help you answer your question about what we can do for you. And then we schedule a case review with me if you qualify, so I can help you take you through this process and identify the root cause. You can schedule for that here at askdrcon.com/get-started. Go to our website, askdrcon.com/get-started, and you can schedule a discovery call. It's a no-cost 15-minute call. Now, this 15-minute call, please don't abuse it. This is not for you to, ask my staff, who's not a doctor. They're just there to answer your question. So hey, can I take this? They're not there to diagnose or treat you. They're there to identify what is your symptom, what is your condition, and whether we're the right person to help you or not. But you're going to already find tons of value just in that 15 minutes, because they're really good. I train them to find out what your sticking points are. And then you have clarity. See, it's about having clarity. So you do what's best for you. If what's best for you is working with us, we'll tell you. If it's not, we'll point you to some of the resources. But watching the video is really helpful. Now, some of the things that we can do, can we detox some of these pathogens? Yes, natural antimicrobials that is not harsh on your system, so you don't destroy your body by taking medication. We can use natural things. And sometimes medication is appropriate. It just depends on what's going on with you. Can we work on these immune imbalance? Absolutely. We can stabilize this with natural supplement. For example, vitamin D is critical for balancing that. Glutathione is critical for balancing that. Fish oil is really important for systemic inflammation. Resveratrol and other flavonoids can help with this. Sulforaphane, such as found in broccoli seed extract. We can do things with T helper 17. We have a product called nitrate synergy that support the T helper 17 pathway to balance that. We can support autoimmune flare by identifying other triggers such as food, and you work with a nutritionist, so we give you customized eating plan and recipes so that makes it simple so you can actually do it. And this is based on your situation you're testing, so no two persons alike. It's customized. Can we do things with brain inflammation? Absolutely. There are flavonoid compounds that we can use to really dampen that brain inflammation, like glutathione, like EPA-DHA from fish oil, like curcumin can really help with that. Can we help with insulin resistance? Yes. Dietarily, insulin resistance responds beautifully. If it's driven by systemic inflammation, though, then you need to dampen that inflammation and further identify the source of that inflammation. Decrease vagus nerve output. There's exercise you can do to stimulate that vagus nerve, and that's part of what we help our clients with. Gut inflammation? Absolutely. GI Resuscitate is the product we use to help heal leaky gut. So there's a lot of things that we can do to help with this, but if you didn't know that, if you didn't know the map, it can be, you're just shotgunning it, right? You're not following a roadmap, a flow chart to kind of get you from point A to point B. You're just randomly going at it, and that's why you're pulled in 10 different directions with 20 different supplements and you don't feel better. So please don't self-diagnose, self-treat. This video is intended to be educational and informational purposes only. Please always seek the help of a qualified healthcare provider like myself to help you walk through it, do the appropriate lab tests, take a very solid history so we know what's going on with you. So it starts with a case review. And if you'd like to get started, go to askdrcom.com/get started. We would love to talk to you, see if our program is a good fit for you. In the meantime, if you felt this video was helpful for you, that tied together how the brain, the immune system, and the gut is all connected, please share this video, like the video, comment if you have any questions. I answer all the comments personally myself. And please spread the word and let people know that there's hope. There are things that you can do, but there's a right way to do it and there's a wrong way to do it. So hopefully you get a lot of value from this, and I look forward to seeing you next week at the Ask Dr. Khan Show. Take care.